The stories shared on It Takes Balls are unique to the individual sharing. Always speak with your trusted medical provider for treatment options specific to you. Welcome back to It Takes Balls by the Testicular Cancer Awareness Foundation. Today I'm joined by Nickalaus Goodman, who's a testicular cancer survivor. Nickalaus, thanks for being here.
Yeah, of course. It's my pleasure.
So you are a testicular cancer survivor, but on your day job, you are a SVP of Clinical Finance and a paramedic. Tell me about that.
Yeah. So when I turned 18, I became a paramedic, and I've worked as a paramedic in my local community for 20 years now. And so I kind of realized about 3 to 4 years into that was not going to be the career that I wanted. So I went back to school, got an MBA, and then started working on the administration side of healthcare. And I've been doing operations and finance for about the past 8 years.
Interesting. All right. So let's delve into your testicular cancer story. Take me to the very beginning.
Yeah. So let's go back to 2018, when life was normal. In the summer of 2018, sometime in June, I had just some discomfort. Things just didn't feel normal to me. Went and saw the doctor. The doctor's like, not really sure what this is. Let's just do an ultrasound, take a look and see what we see. So they did an ultrasound in 2018 and found that there was a cyst, but nothing really else to worry about or of concern. Took some antibiotics just in case. Got better in a couple weeks. Kind of went on about my life. 2019, very similar situation again. He said, well, let's just do another ultrasound to see if there's anything that's changed, and go from there. And in that ultrasound, they discovered that I had microlithiasis in both. And, that was about all that they could determine was there. So my urologist said, hey, let's just watch this for the next 3 years, see what kind of happens. We'll kind of just go from there. So 2020, I worked in healthcare as a paramedic. So, COVID rolls around, things get kind of crazy, busy, uncertain. So I scheduled the ultrasound at the 1 year mark. From the prior year, I was perfectly fine. No signs, no symptoms, nothing going on in my life other than I just got to take a day and go get this ultrasound. And this would probably be my third ultrasound. The first 2 times I had the same tech. And this third time I had a different tech, which was kind of just different. And I went in again, nothing wrong with me, just there for the routine thing. And she took forever. And I was just like, this is like my third one. Like, this is normally like a 20-minute thing and we're done. And I've been here for like 35 minutes and I feel like we're not even halfway there. And so I asked her, I said, hey, like, are you new? How long have you been doing this? And she says, oh, I've been doing this for about 20 years. And I'm like, oh, okay. And then I hear the printer going off in the background, which I'd never heard before. And I was like, hey, I guess I get some souvenirs today. And she just kind of, said, yeah, if you want to take home some souvenirs, we'll get you some. And so this is July of 2020, July 14th, actually. So I said, well, it's all said and done. I said, well, I guess somebody will call me in about a week. She's like, no, I think somebody will call you today. And I said, okay. And I didn't think anything of it at all. Just left, went on about my day. And later that afternoon around 3:00, I actually missed a call from my primary care doctor. And I was like, dang, I'll never get a hold of him again. It's 5:00 now. Like, what did he want to talk about? It's odd for your doctor to call you personally. So about 5:30, he actually called back and I answered the phone and he said, hey, the ultrasound today kind of showed some things that are questionable. I think it's probably best if we go ahead and get you to see urology, have them weigh in on what's going on. And I said, okay. And I knew at some point that the radiology would show up in my online medical record. So I kind of was expecting that, knew that would happen. And I guess that was probably about a week later that showed up. But the urologist office called the next day, said, hey, can you come in tomorrow? And I was like, oh, tomorrow's not a good day. Like, I'm busy. And they're like, are you sure? And I'm like, yeah, so I still in the back of my mind knew something must be important since the doctor called me, but I still wasn't thinking that there was anything serious going on. And then later that night, I actually got the radiology thing popped up in my chart, and I started reading it and seeing all the horrible things that said. And I was like, oh crap. So like I called the urologist first thing Monday morning. I'm like, I can be there in 5 minutes. Like, and they said, well, our next appointment is on Wednesday. And I was like, okay, well, I'll take it. So in my job, I work with, several hundred physicians. So I have access to, good resources. So I'm like texting this thing out to everybody I can find that I trusted, and was like, what are our thoughts? And they're like, yeah, it sounds like you need to see the urologist as soon as you can. I said, okay, sounds great. So saw the urologist I got an appointment at a different urologist because I just couldn't wait till Wednesday. So I went to a different urologist on Tuesday, and he's like, yeah, like, when you want to go to the OR? And I'm like, I don't want to go to the OR. Like, what are we talking about here? And so it was a 1/2 millimeter. So we're not like even large in stature yet when you talk about tumor size, right? 1/2 millimeter is nothing. And I was like, well, can we just watch it? Is that an option? Like, let's just watch this thing and see what happens. And he's like, well, you can, but I'd rather just take you to the OR like tomorrow if you're not doing anything. And I'm like, okay, well, I'm seeing my regular urologist tomorrow. So I saw him, and same story, like, hey, what are you doing, on Friday? And I was kind of like, I don't know. So I kind of hemmed and hawed. And on the 31st of July, I actually went through with the surgery, and had the orchiectomy on the 31st of July, and didn't tell anybody, just showed up at the hospital at like 3 p.m. and just went through it.
Wow.
So, yeah.
In your story that you submitted, and for anybody who's listening that doesn't know, you can go on the Testicular Cancer Awareness Foundation website and submit, like Nickalaus did, to be on the podcast. You mentioned, pain in your testicle is not always testicular cancer, and that is true. So what made you finally like decide, like, I should go be seen?
Yeah. So this is something I always tell people, is to just be very acutely aware of your body. Understand your body. And when you feel like something's not right, don't ignore your body. Our bodies do a really good job of telling us something is wrong if we'll only listen. And I guess just in my career, bad things happen to good people all the time. And I see that almost every day that I go to work. And, I knew that I wasn't supposed to have pain. I knew that if I had pain, that it wouldn't last, more than a couple of days and should go away. And the inflammation should for sure go away rather quickly. So let's also kind of talk about risk factors, because I think that's important. So I would just turn 36. So I'm just outside the age range, but I was inside the age range when I was doing the ultrasounds. So that kind of was one thing that I thought about. The second thing is I did have a orchiectomy as a kid. So unassisted testicle that was surgically corrected. So that's another risk factor. Mm-hmm. So I could like check the boxes as you go down the risk factor list. And I had just had a really close friend go through cancer, and she had ignored the signs and symptoms. And I was like, oh, I don't want to ignore signs and symptoms. I'd rather just go find out, get it over with. And so that's just kind of been my philosophy through this whole thing is, not all things are cancer, not all things are pain, but you do need to be aware of your body. And I knew that something just wasn't right. I just had that feeling that my body's trying to tell me something. And so that's why I went. But immediately when you get it, everybody's like, man, I've got this little pain in my, like they think you've become like this golden urologist that can just like touch them and say, that's what this is or isn't. And that's not the case. And I don't think that if you have pain that's associated with something else that you have to think that it's cancer. But I do think that you have to know your body, you have to know your risk factors, and you have to know the signs and the symptoms. And if things align, then you go forward with it, right?
Yeah, that's something like for me now in survivorship, I'm still, not quite 5 years out, but I feel a little bit of pain. I'm like, oh, is it do I have toe cancer now? You know what I mean?
Yeah.
Yeah. So, you mentioned, I think we're like medical fraternal twins, that you get all your bad news in June, because that's for me too. And my birthday is also in June, like you said.
Yeah.
Yeah. So You had so micro, say that,
Microlithiasis.
talk about that some more, because that's not a word I've heard.
Yeah. Yeah. So in 2019, when I got the ultrasound, it came back with microlithiasis. And I asked the urologist, his name is Dr. Johnson, Atlee Johnson's a great guy. He like pulls up the images and he's like, do you see these little just speckles through the testicle? And I'm like, yeah. And he's like, well, that's what we call microlithiasis. It's just calcium that deposits within the testicles. And I said, okay, so what does that mean? And he's like, having microlithiasis doesn't mean that you will have cancer, but having microlithiasis increases your risk of having cancer. And so one of those little bitty specks is what eventually turned into the cancer. So again, microlithiasis doesn't equal cancer, but you generally have microlithiasis at some point if you get the cancer. So
Interesting. Yeah. So
what he told me, yeah.
you really were checking all the boxes.
Oh yeah, for sure. So that's why it's like, you just got to pay attention, right?
Yeah. So talk about like the feeling, because you said you've had multiple ultrasounds, so you were like a professional at getting ultrasounds, and you weren't
Yeah.
thinking anything of it. So when it finally you heard the C word, what was that like?
Yeah. So, you don't really think about it. And, I've been there when we've had to tell patients that they have that. So I've been on the other side of the equation, and, you don't really think much about it. I'm probably desensitized to a lot of things in life. But, when he called and said, hey, there's some things that we need to have looked at by the specialist, I still didn't think much about it. And then the ultrasound itself, says, questionable metastatic disease or something along those lines. And you're just like, oh, like, you know what that is, right? I didn't have to Google it. I didn't have to, WebMD my results. I kind of just knew, just reading the radiology report, that, hey, this is something that's serious. So in the back of my mind, I kind of already knew that. And, the physicians that I work with every day kind of had already alluded to the fact that this is highly likely. But, when you go in, they don't really tell you, right? They're like, you just have a mass, and there's only one way to find out, and that's to remove it and send it to pathology. And I'm like, oh, can't we just like do a needle biopsy or something? Like, isn't there something else we can do? My biggest fear in life has always been surgery. Like, I just am not a fan. I've been in the OR, and it just is not a comfortable place for me. So I've always been terrified of surgery itself. And so that was more scary than like the C word or chemo or anything. Like, the surgery was like my biggest like mental hurdle to overcome. And so when I went in for the procedure, again, I didn't tell anybody. I had my cousin's wife go with me because I had to have a driver, and she was a nurse. And I was like, well, if something happens, then like, this is who I want making decisions. So went in for this surgery, and I told Dr. Johnson, as we went back to do the procedure, I was like, this better be cancer. If I'm going through all of this anxiety and everything else, and I'm going to lose this part of my body, it better be for a good reason. And when I woke up, he's like, it's pretty much, I think this is what we're dealing with. So I think we made the right decision today. So, in the back of my mind, I was fresh out of just dealing with a really close friend, who went through cancer for 5 years. So, I've already been in the whole just mental space of taking care of someone, trying to understand it, knowing that there are things outside of our control that we can't manage. And so when I was told that, hey, for sure you have the cancer, and it's like, okay, all I could think of was what's next. And that was kind of the attitude and mentality I kept through the whole process is, okay, so now what? What do we do now? Where do we go from here? And I just kind of kept that thought process of, okay, what's tomorrow? And I didn't really think about the long term. I tried not to think about, am I going to die or not die? Like, that never really was something I focused on. I really just focused on, okay, what do I need to do to make myself better? And if what I need to do isn't going to make me better, then let's not do it. So I just took that mentality of, like, what's next? And so that's why I just kept asking every day was, what's next? What's tomorrow?
Yeah, I mean, one day at a time is all any of us can do, especially when we're going through this diagnosis and treatment. I mean, there's only no point to look past, what can, like you're saying, what can I do right now?
Yeah.
Talk more about, you said you've been on both sides of the coin. So as someone who has given the news, talk more about like when the provider gave it to you. Is it, did they handle it in a good way, like good bedside manner? How was that?
Yeah. So first of all, the physician always would give the news. We're just there in support, right, in our roles. So you'd be in the room, the physician would tell the patient what was going on, and then you're there to really just help them navigate the next, 30 minutes, make sure, just emotional support for them, really. I've known Dr. Johnson my whole career. So I worked in the ED for about 12 years. I worked with him side by side, did procedures with him, so it's kind of different when you have that relationship. So I think that that's probably unique and different. And other people probably wouldn't get the same approach that I received. I think that I put myself in a position to be ready for the news as well. And, I was just very clear, like, whatever this is, we're just going to deal with it. And I think that I was treated that way from their perspective, right? So, I have always been a fan of just tell me the data, like just let me know what's going on. And so I didn't really need a lot of that, what we would call fluff, if you will. Like, let's just go straight to the data points. Let's just understand exactly what we're dealing with and kind of go from there. So I think that being on both sides, I respected just tell me how it is and let's just figure it out, right? And give me like good concrete data. I could tell that it was completely different when I went to the specialty oncologist at the larger center in Charlotte, Dr. Merriman. He was, never met him, didn't know him. So it was a completely different patient relationship because it was very much, okay, how are you feeling? How are you doing? Here's what I know. Here's what you need to know versus when I'm in an environment where I know people professionally, it was kind of like, here's what we're dealing with kind of thing. So I think that that's really the difference.
Kind of going down a different route just because of your job. You said you're there for the next 30 minutes kind of supporting people.
Yeah.
So when somebody has just been given the news and then somebody like you walks in, what kind of questions should they be asking you? What kinds of things are they talking about with you?
Yeah. So in emergency medicine, which is where I'm at, everything we find is typically incidental, right? You weren't looking for it. You just happen to do that head CT. You happen to do the chest X-ray and these things pop up. And so the physician has to go in and make a decision. Do I say anything or do I just refer them to, a specialist and not say anything? Like if it's like a for sure deal, generally they'll just go ahead and tell them what they see. If it's kind of questionable, sometimes they won't. They'll just make them follow up because you don't want to ever give someone the wrong data, right? And so, you walk in a room, someone's just had a chest X-ray. They find that they have some kind of questionable things on the chest X-ray that look pretty consistent with, a form of a cancer. And the physician basically explains to them, hey, we did a chest X-ray. We found something that looks like, acts like something similar to cancer. We don't know what it is. Someone will have to investigate that for you. But this is kind of what we see. So then, enters nursing team and resources. And the patients generally are, first of all, in shock because that's not what they were expecting. These patients are typically otherwise healthy. And so, you're there to just kind of support them. The questions that they typically ask are, that whole, okay, so now what do I do? Am I going home? Am I not going home? Who do I call? What do I need to do? And really, our job is to say, okay, like you need to just take this one step at a time. I'm going to make sure that we can get you into an appointment. Do you have a preference on who you would like to see? Is there anyone I can call for you? A lot of people don't go through the hysteria and the crying and everything right away. It's still kind of just very, like the shock is still there and they kind of haven't quite processed it. A lot of what we do is really just make sure that we understand where they're at. Do you have someone at home with you? Are you going to be safe when you go home? Is there someone you can talk to? That's really what we're focused on, is when they leave, where are they going and who's going to be with them? Because you don't want to send somebody home by themselves in that environment.
Yeah.
So,
Okay. Yeah, that makes sense. Let's get back to your story. Do you know what your pathology ended up coming back as?
100% embryonal carcinoma.
Wow. Okay. So was it contained to the testicle?
I had LVI.
Okay.
So, yeah, I was 1B with LVI.
So did you do any chemo?
Yes. So I did 1 cycle of BEP chemo, which, I think everybody is different. Everybody's pathology is different. They give you the guidelines, basically, right? These are the Institute of Health guidelines. And when you have that embryonal carcinoma component and you have LVI, like, you fall into this category and you have 3 options, right? Surgery, obviously, you must have, got to do that. No getting around it. Then there's the RPLD, which is still kind of like, do you do it or do you not do it? I'd already had the CT scans and nothing had showed up on the CT scans. My tumor marker was normal. My hormone levels were normal. Like, everything in my blood work was spot on. Nothing was showing up. The CT didn't show anything. So I was like, well, we're not doing that, because who wants to go through that? And then it was the conversation of, do chemo prophylactically, basically, reduce your risk of reoccurrence down to less than 10%, do 2 cycles, go down to maybe 5%, or do nothing and be like a 50-50. And I'm not lucky at all with anything in life. So if we're going to flip a coin, I'm always going to get the bad side of the deal. So I was really concerned as to what to do, what decision to make. So I reached out to people to try to find who could I talk to that could help me with this decision, right? I need more information. So I reached out to a couple people who had it earlier in life that I knew, and asked them kind of like, what was your pathology? What did you do? What did you not do? And then our health system has nurse navigators that specialize in oncology, right? So their only job is to help cancer patients navigate this world, right? And so I called and talked to her and said, hey, I would really like to talk to somebody else who's recently gone through this and kind of get their opinion. So I was connected with somebody from Charlotte who had gone through it about a year before, and had talked to him, same pathology. I want to say that his blood work was completely normal. His CT was normal. He opted to do like the RPLD. I did not do that. Didn't feel like it was necessary, but he did it. And he said, I'm grateful that I did it because they found it in some of the nodes that they removed. And, my oncologist was like, I'd rather it show up so we know what we're looking for than just go exploring. Nobody likes Dora showing up at the OR table, right? So I did not do it. I talked to him, kind of got a good feeling that, we're going to go through the chemo. We're going to do this, and this is where we're going to be. And that's when I met with the specialty oncologist to make sure that he agreed, and he agreed that we start with chemo and we go from there. And then we started down the process of the chemo, and I started that September 7th, so 6 weeks later. That was the earliest that they would let me do it. And I was like, let's just get it over with. Let's just, I got things to do, so let's get this done. I think the interesting part of all of this is we're only 3 to 4 months into COVID when this started. So, I'm working, I'm around these patients. Still, nobody wants to see you when you're around the patients, right? So everybody kind of like treats you like you've got the plague. Mm-hmm. So I think it was I feel like I was cheated a little bit through the process because people couldn't really come and support you because nobody could go anywhere. Nobody could do anything. You kind of laugh when you walk into the oncology center and they're like, do you have a loss of taste or smell. Well, yeah, I haven't tasted anything for weeks. And, how do you feel? I feel like crap. Like, and it's just like, why are you even asking these questions? Because I'm going to say yes to all of them. So, I did that. I thought that it was a good experience. We had a brand new cancer center. It had been open like a week, maybe. So still trying to get the little kinks worked out. But, all in all, it wasn't a terrible experience. I don't think that anybody should be scared of it or worry. I think that when you're told this, you just want more information. And me specifically, I want to know exactly what's going to happen. I need you to tell me what's going to happen on day 1, day 2. Like, I need like the play by play. And everyone's response was, well, it's different for everyone. And I hated that response because I just wanted to know like what exactly is going to happen, because I felt like I could prepare. But the unknown was like super scary for me. Right.
Yeah.
And looking back, I can say that it was all time durated. It was over with in about 6 weeks. It wasn't fun, but you can get through it. So that's what I tell people now is you can get through it. It's not the worst thing in the world.
Yeah. Did you have any notable events that, you might point out during chemo that other people might experience so they can kind of know what to expect?
Yeah. So I blogged about all of this every day. I would go in and say, this is exactly what happened. So anybody can go and look at that. It's out there for the world. So I did all 3. I did the BP. We were questionable on the bleo just because there's still a lot of, do we give it or do we not give it? Is it worth it? I think that's probably the hardest drug that I got. I mean, the cisplatin was no fun, but the bleo really did a number on my ability to just kind of like not feel like I'm going to be out of breath, for about the first 6 months. So, things that I experienced that I didn't expect were hiccups and heartburn. It was the worst. And at first, I didn't realize that it was a side effect. I just remember day 2 or day 3 waking up with just this horrible heartburn. And I don't get heartburn. And I was like, I don't know what's going on with me. I couldn't drink enough. I couldn't sleep. And then the hiccups started, and they just did not let up. And they were like legit hiccups. Like you're not going to not notice them.
Yeah.
So I guess you had the same thing.
Yeah. It was like my second or third day. I just did EP, but my second or third day I was at Chick-fil-A with my parents, and I just started getting hiccups, and I was like, what the heck is this? So I took some of the anti-nausea medicine, and that didn't seem to work. Maybe it was taking some time to take effect. And then I was like looking up home remedies, and I found one that was like, take a cup of water and like drink from the far side. So it looks stupid, but I did that and it seemed to work. So, but yeah, hiccups were crazy.
Yeah. So I'm told that it's a side effect of all of the steroids that you get. And so when I went in the next day, they're like, how are things going? I'm like, well, I've had these hiccups and you won't believe it, but they've stopped for like the last 5 minutes. And then they started again. And I was like, they're just exhausting because they just don't stop. And then they got to the point where they were so bad, I was like starting to get sick. And they're like, we don't want you getting sick. So they gave me some medicine. I want to say baclofen maybe was what they gave me. And it got rid of the hiccups. Like I didn't know there was a medicine for it, but there is. So the hiccups were interesting. That Friday, I had a lot of fluid retention. I want to say like 20 pounds of fluid retention that happened pretty much overnight.
Oh my gosh.
So that was no fun. So I pretty much spent the next day kind of just trying to get all that fluid off, which I did.
Was that just
it's like
peeing it out or what?
Yeah.
Oh my gosh.
Just kicked my kidneys into high gear, and there was there's no bathroom in the room there where you get chemo. So I was like back and forth. I was like, can we just move me to the bathroom at this point? Because I'm just exhausted carrying this weight, first of all, and then just like peeing for days, it felt like. But other than that, everything was pretty much on course. nothing surprising. They did make sure I didn't have a PE because the bleo can cause a PE. So they were making sure that the fluid wasn't from that. But other than that, it was pretty straightforward. Nothing out of the ordinary. I didn't lose my hair till probably a week to 2 weeks after I finished, which was, I always thought like you'd be sitting there and they would start putting the stuff in your IV and then you would just instantly feel like something was wrong. Totally not the case, right? Such a myth that, it was probably 4 or 5 days before I even really felt it. Mm-hmm. And I think that, I was a little disappointed that my hair didn't fall out like instantly because I was kind of like, can we just get this over with? But then about a week, I think after I finished is when it just started like, it almost hurt to just stay in my head. Like I just wanted it all out.
Yeah.
So like I aggressively just got rid of it because it felt a lot better to not have it in my head.
I don't know if you're talking about like mentally hurt or physically, but I know that mine like physically hurt. It was like, the hairs were there, but they weren't like rooted, so it was just like a bunch of like porcupines,
Yeah. It didn't feel like your hair and it just didn't feel comfortable. Yeah. It was physical for me, not mental.
Yeah. So you're about what, like a year and a half out now, or are we coming up on 2 years?
Yeah. So 18 months ago today is when I finished the chemo. So I'm 18 months out. I just had my 3-month oncology appointment on Friday. So I've got one more at the 3-month mark, and then I'll be switching to the 6 months. I'll do my CT and chest X-ray in 3 months, and then I'll start into year number 3.
Awesome. So, congratulations. How is, in those last 18 months, has your life changed at all? Like your outlook on life? I mean, tell me about that.
Yeah. So I think that what you think is important in life changes. So, most of my life, if I haven't worked 80 to 100 hours a week, it just wasn't a normal week for me. I've always been the type of person that just goes to work, stays busy. I don't really take a lot of time for myself, but I think once you find out that this is like a reality for you, it puts things into perspective. And, you could have a stroke, you could have a heart attack. There's lots of things that could happen to you that will change your baseline health status. And I think that you think it'll never happen to you. And so when something like this does happen to you, you start thinking what's really important in life, and working 80 to 100 hours a week isn't worth it anymore. So I think I've changed my lifestyle and just been more about self-care, understanding that, taking care of yourself is important, enjoying life is important because, before long it'll be over. So we need to take time to enjoy it. So that's kind of what's changed for me in the last 18 months.
Yeah. My doctors told me when I was going through chemo to stick to routine as much as possible because that would help kind of make things feel normal. Were you working 80 to 100 hours a week during treatment?
No. So I actually when I found out that I had it, I kind of stopped working as a paramedic because I was like, don't have time for that right now. Like, that is a second job. So let me focus on my primary job. Mm-hmm. And COVID's still going on, right? There's so many things going around COVID. We don't know what it's going to do. We don't know how it's really responding or reacting. We're high risk. So as that was going on, I was like, well, the last thing I need to do is get COVID through all of this. Yeah. So I kind of just reduced my exposure and did not work as a paramedic. I did not go back to working as a paramedic till probably February of that year. And then I just worked at a vaccine clinic for 6 months, probably just passing out vaccines because we just didn't know. And nobody really knew. So, again, I feel like I got cheated because I had like amazing friends who are like, oh, I'll fly out and take you to chemo one day. And I'm like, well, you can't go in. You got to quarantine for 2 weeks before you can see me. And like, it just doesn't work. So if you looked at my blog, you'll see the people who would come and like stand outside the window and just like had signs for me. pouring down rain. They had signs for me. Like every day somebody would come and just stand outside the window and just show support, because that's really all that you could do. So I think that, once chemo finished, I still was scared to go back, because we just really, your counts are still dropping. You're still trying to rebound and rebuild. So the last thing you want to do is get some unknown virus that could potentially end your life. So I kind of stayed away from it as much as possible. So through treatment, we had already transitioned to working from home. So I worked from the oncology center for probably the first 3 days. And then the next 5 days, I did not work at all. And then I went back to working after that. I think days 7 to 11 were the worst. And then after that, I went back to working. So I was really only out of work 40 hours, and I was only working 8 hours a day from home anyway. So I never really stopped working, except for that 1 week.
Jeez, he's like Superman.
Well, you just got to keep your mind you can't let it become your life, right? It just has to be a part of your life. I did get a PICLON, so I recommend PICLONs for anybody who's got to go through that. I just was not a fan of getting stuck every day. So I did get a PICLON, and I think that made everything a whole lot easier, because you just walk in and they just have direct access, and there was no fuss or fuss about any of it. So I think that helped me feel better every day too, because there's literally nothing that was stopping me from, work on the computer all day, right? I didn't have to worry about wires and things. Like everything was coming right out of my armpit, basically. Mm-hmm. So it didn't really, keep me from doing anything I wanted to do.
Awesome.
COVID was more of a hinder than chemo.
Yeah. I had a port. Mine's hanging right here. I don't know if you can see it. It kind of blends in with the wall a little bit. But,
oh, yeah.
Tell me more about the cancer center, in COVID. I know for mine, I was before COVID, and I was the youngest one in there by far, but I had all these old guys and old women sitting next to me, and they were always chatty. So, I mean, your guests had to stay on the outside where you're 6 feet from everybody, I assume, and...
Yeah, so this is a brand new cancer center that had just been built. I served on a committee at the hospital, and they told us probably in 2018 that they were going to build this new cancer center and get, all these fancy radiological things. And I can't remember what it's called now, but and as I'm sitting in that meeting, I'm thinking, why do we need a cancer center? Like, do that many people need this new big building? Because we had one already. So basically moved them into a new building and made this really, state-of-the-art facility. So it's pods. So I think each pod has 10 rooms, and they're actual legit rooms. And so I was in room number 5 every day. So you try to keep your same room just for, disease prevention, I guess, infection control type stuff. There were not a lot of people in there. You don't really get to see them because you go in and you go straight to your room, and then your door is closed the whole time. It was the best recliner I think I've ever sat in my life. Like, if I could buy that thing and bring it home, I would. But it's interesting because a dear friend of mine who's a nurse, we had worked together at some free clinics for a couple of years, and that's how we knew each other, was just through free clinics. It's not really outside of that. And I always seem to bump into her random places. But one day I went in, and she was in the room, like across the desk from me, and I was like, why is she here today? And so I told her, I was like, hey, tell her that I'm here. Like, make sure she knows I'm here. I'd love to talk to her. So, I was the same age. We're both the same age. So it was really interesting for us both to be there at the same time. But of course they let the patients themselves mingle with each other. But outside of that, like, no family, no friends, like, drop you off in the morning, come back and pick you up in the evening. It was not, you want to see me, you got to come to the window. Like, that's the extent of what I'll be able to have right now. So, and it was more so just for everyone else's precaution than your own. I moved in my 85-year-old grandmother because I'm single, so I live by myself. So I moved in my 85-year-old grandmother. I was like, someone needs to be here that's not going to be out and about and potentially bring COVID into the house.
Yeah.
So who better than grandma, right? So I was like, she can always call 911 if something happens. And she had meals cooked for breakfast, lunch, and dinner. Eating was really, really hard for me. I didn't want to eat anything. Pedialyte is the worst thing in the world. Like, the nutritionist was like, just eat butter. Like, I just need you to get calories in. Like, whatever you do, like you eat toast covered in butter. Like, I need you to get calories in because you're losing weight too quickly through this process. And I was like, I just don't want to eat anything, like not even a milkshake. And then baked potatoes became like my go-to. That was the one thing I could eat that didn't bother me, was chicken and rice and baked potatoes.
All right. So talking about friends and family, I know before your orchiectomy, you didn't tell anybody except for your cousin's wife. When did kind of you let everybody in on what was going on?
Yeah. So I guess I don't really remember the extent of telling everyone, but I remember after having the surgery, I had my cousin drive me to my grandmother's house. And, I sat down and she's like, how did your surgery go today? Or how are you? And I was like, well, I just got done with surgery. And they're like, she's like, you just had surgery. And I'm like, yeah. And I just chalked it up because I didn't want her to really worry, because she just is a warrior by nature. She had a son die of cancer. So like, I just did not want her to just associate everything together. So I had told her that it was just an infection that they had to surgically clear out, and left it at that. And I pretty much started telling the family, it took about a week to get the pathology back. And I had already started telling the family that I was close to at that point, like, hey, they think this is cancer. Here's potentially what's going to happen. It looks like chemo's in the cards. And then once you tell about one or two people, in the South, everybody knows. And, the neighbor down the street's bringing you a get well basket. So I just kind of told one or two people, and that was really all I had to tell. And then I just kind of, on a Zoom call at work one day, was like, hey guys, like the next 3 weeks, I'm kind of going to be hit or miss, and here's why. And that was kind of really it. I didn't make a big deal about it because I've learned that there's always someone else that's going through something worse than you are.
Mm-hmm.
And you should never assume that your day is the worst day. And, there were people at work who were either going through chemo or had just finished chemo who would like call and say, hey, I'm right there with you. And so I don't think we realize how many people are affected by things, and never go into the situation thinking that you're like the worst, right? They sent me to a support group. That was the worst experience of my life. They put me into a support group based on age. So everyone was in their 30s and had some form of cancer. And like everyone's introducing themselves, and, the first person's like, I've got this really rare, bile duct cancer, and like just horrible stuff these people have to go through. And they come to you and you're like, well, I just have testicular cancer. Like, I just got to go through some chemo. And that's why to say that what we go through is like not bad or not hard. But I mean, some of these people were like knocking on death's door and just really struggling to get through. So I think it's just a testament to like good research, early prevention, knowing your body can keep you from being in that scenario. Because there's people with testicular cancer that are way worse, right? That are just struggling every day, and they're like trying experimental things, but their pathology has gotten so far down the spectrum that it's just so hard at that point to fight a germ cell cancer. And so I think that's why like my whole thing is like, just know your body. Don't be scared to ask questions. Doctors are not embarrassed. You're the only one in the room that feels uncomfortable. They play with people's balls all day long. Like, it's not a big deal for them, right? It's just another
athletes.
pair. Yeah. So just like, don't hold back, because I think when you hold back, you end up like way far worse than you needed to be.
Yeah. Well, it sounds like you had a great support system, even though they could only be there in a limited capacity. So I know you've had some side effects you mentioned in your submission. Talk about that.
Yeah, the side effects. Well, first of all, I have allergies. I've never had allergies before in my entire life. I don't know if that's new or not new for other people, but I mean, I've never had to take a daily allergy pill, but if I don't take it, it's the worst. My hormone levels have now not been normal ever since the surgery, really. So I've been now working on hormone replacement, which is not typical, but for me, it's become just my norm. The Bleo has probably been the worst, and I've never been like a huge like gym buff, like lift weights, but I have always enjoyed just good cardio, like just getting out and going for a good walk or taking the dog or, doing something that's of some cardiovascular stress. And even with my job, just the stress of it. And I have found that I get so short of breath so quick now. And that's 100% the Bleo. And it has gotten better. It has greatly improved. I would probably say about 8 to 9 months after. And I started feeling better, but I really had to just start pushing myself and forcing my body to just adapt to it. So that's been kind of an unintended consequence. But that's pretty much the major things that I've gone through or suffered. Hair came back, didn't have any problems with that. It's never been curly before, but it's nice and curly now. So you just have to rock it. But yeah, other than that, things haven't been too bad. Like I would do it again if I had to. It's just,
that's great. You've kind of touched a lot on advice as far as like one day at a time and, know your body. But if you had to give a piece of advice to somebody who's just starting down this road, what would it be?
Yeah. So I would say, stay off Google. It's not going to help you. Find a friend, someone that you can talk to that's been through it. Ask them the questions that are important and realize that your situation and pathology is not necessarily the same as theirs. So just because they had to go through something doesn't mean that you will. And, I think the other thing I would say is just really focus on what's important and don't get hung up on the details, because the details, I think, are where you can get lost. And by that, I mean just the side effects of everything. Like when you go through chemo and they give you like the ream of paper on all the things that potentially might happen to you as a result, like don't focus on that stuff. Just focus on the bigger picture. Like everything has an unintended consequence at some point in life, but the benefit far outweighs the risk.
Awesome. That's great advice. Hey, Nickalaus, thank you so much for talking with us today. I really appreciate it.
Yeah, no problem.
For more information and resources for your testicular cancer journey, visit testicularcancerawarenessfoundation.org. You can also follow us on social media at Testis Cancer. We're on Facebook at Testicular Cancer Awareness Foundation.